already. Great, thank you so much. So we're now recording, and I'm going to turn it over to Carlos to continue to walk us through a few housekeeping items.
Saludos everyone, this is Carlos Velasquez of the city's recovery task force team. Just some housekeeping notes, the regular ones we share. This meeting will include interpretation in Spanish and Vietnamese. And so thank you to our interpreters for today, our regulars. We have Armando, Vincent, Tiffany, and Priscilla. To access the interpretation in Spanish and Vietnamese, click on the interpretation button on your Zoom screen and then select the appropriate language. And in addition, the interpretation for all of you is set to "ah." So if you, just to make sure that you can hear the English interpretation, we recommend that for all of you who do want to hear it in English, to click on the interpretation icon and click on English. We do have two videos, one in Spanish and another in Vietnamese that will play right now.
Hola y bienvenidos a esta reunión. Para acceder a la función de interpretación, haga clic en el icono del globo en la parte inferior de la ventana de Zoom y selecciona el idioma que desea. Para escuchar claramente el audio de interpretación, le recomendamos que también seleccione la opción para silenciar el audio original, que es la opción más baja en el menú después de hacer clic en el icono del globo.
Xin chào và cảm ơn quý vị đã tham dự buổi họp ngày hôm nay. Để truy cập vào phần thông dịch của ứng dụng Zoom, xin nhấn vào biểu tượng hình quả địa cầu ở phía dưới của màn hình và chọn ngôn ngữ theo ý muốn của quý vị. Để nghe rõ lời phiên dịch, chúng tôi khuyến khích quý vị chọn chức năng tắt âm thanh gốc nằm ở phía cuối trong phần tùy chọn của biểu tượng quả địa cầu.
Great. And so task force members, we ask all of you to rename yourselves on Zoom by first and last name, and to also add your organization, just so we can make sure that we can identify you as a task force member. All you have to do is just hover over your image and click on the little three dots on the top right corner of your image and click on rename, and that'll allow you to rename yourself on Zoom. This meeting is also open to the public. Saludos to all of you. Thank you so much for being here. You'll be able to see and hear tonight's meeting. And you will also have the opportunity for 2 minutes time to share your voice and comments during the public comment portion of the meeting, which is going to happen towards the end of the meeting. Until then, we appreciate your patience during the rest of the meeting. And for task force members, there will be time after each section of the agenda for questions. And we ask that if you do have a question, to use the raise your hand feature found below on your Zoom screen. And either Rosalind, myself, or one of the task force team members will be the one announcing your name so you can unmute yourself. And we do also ask folks that once you unmute yourself and start commenting, to first introduce yourself by your name and title, just so we can make sure that we're allowing all members of the community to access the audio and understand and follow the meeting. I think that's it. Back to you, Rosalind.
Great. Thank you so much, Carlos. Appreciate that. So we like to start all of our task force meetings acknowledging that we are on the ancestral lands of the Ohlone people. We pay respect to their elders, past and present, and we give thanks to their sacrifice and examples of humility, stewardship, and resilience. And with that, we're going to go right into the agenda for tonight. I'll do a quick review of what we're going to cover. So we're going to start off with some updates that we want to share with the task force members, and also ask members of the task force if they have any announcements to share with the group. We have a panel discussion that we're really excited about. We have representatives from both the city and the county emergency operations centers. Then we're going to have an update on the community engagement plan, as well as the lived experience group. And at that item, there actually is going to be an action item for the task force. And then we'll end our meeting, as always, with public comment and next steps. So next slide. So, okay, so here we go. We have quite a few actually updates to share with the task force this evening. First of all, on April 27th, city staff provided an update on the work of the COVID-19 Recovery Task Force to the members of the, oh, you know what? I jumped ahead. I'm sorry. The first item is the April 27th Task Force Steering Committee meeting. They actually at that meeting set the agenda for tonight's meeting. Committee chairs provided updates on their work, and those updates have been provided to the task force members in an email, and they're also available on our website. The next item are all of the updates we have coming from our city council. So again, back on April 25th, city staff provided an update on the task force work to the Community and Economic Development Committee. We shared about the formation of the committees and the work that's been underway. We also shared the proposal for the framework for developing recommendations that will be going to City Council later this year. And we also shared with them the ideas around the community engagement plan. At its meeting on April 26th, the City Council approved a spending plan for $10.5 million of American Rescue Plan funding to support children and youth programs and services. And so this is a tremendous opportunity for the city to continue actually to provide much needed services to our children and youth. And we thought that this would be of great interest to the task force, particularly our committee on child care and youth development. Also, just want to make sure that task force members are aware that the city's 2022-2023 budget process is underway. Budget study sessions actually kicked off yesterday. They will continue until Monday, May 16th. And in addition to that, there are community meetings that are planned, including one meeting that was held last night. 2 more community budget meetings will be held on Saturday, May 21st, as well as on Monday, May 23rd. So we'll make sure to get that information shared with all of you. One important item that we did want to share with all of you is that in the proposed budget that was released, it does include $2 million of ARP funding to be set aside for the Recovery Task Force recommendations that the group will be working on and getting to City Council later this fall. So excited to share that information with you. And with that, I think now I'm going to hand it over to Demetria to share some information about vaccination messaging.
Thanks,
Demetria.
Rosalind. Hi, Rosalind. Thank you so much. And thank you, everyone. Good evening. Glad to be here today. My name is Demetria Machado, and I am the Deputy Public Information Officer for the City of San Jose, focusing on COVID-19 communications. I'd also like to introduce my colleagues, Vicky Day, who's the co-director, and Jovana Ivanek, who is our team's content developer. As I mentioned, we focus on COVID-19 communications, so that is outreach for vaccination and boosting messaging. We're also focusing on connecting our most affected residents with resources as they recover from the pandemic. We are currently working with the task force team, Carlos and Aurelia, to develop a one-page flyer for residents with city-specific resources, which will be translated in 4 languages, or translate into 3, Spanish, Vietnamese, and traditional Chinese. This flyer will be used to be distributed at some of the task force plan pop-up events, and will be utilized as a resource for your task force. As mentioned, not only are we underway with the communication efforts for COVID-19, we are focusing on underserved communities. We have reached out to you, or will be reaching out to you for support, for feedback, And then finding ways to collaborate on messaging or help with distributing messages. Once the federal government approves a vaccination for those ages 6 months to 5 years old, we may be reaching out again to get messages out to parents and those that have agency over children, the young children, and we'll be doing outreach to daycare centers throughout San Jose. So my email is on the slide. So if you have any questions or like to reach out and contact us to see how we can support messaging in our communities, we would love to help you. Thank you, everyone.
Thank you so much, Demetria. We really do appreciate your partnership and that of your team, making a big difference in our community. So thanks again for being here this evening. And so with that, we'll open it up. If any task force members have any announcements that they would like to share with the group, please just raise your hand.
I don't see any, Rosalind.
Yep, I'm not seeing any.
Oh, we'll go.
We have one. Hugo?
Yeah, hi everybody. This is Hugo Garcia with San Jose Jazz. Just wanted to make an announcement, something others may have heard of, but just to make sure everyone has heard. There is a new website, getinternet.gov, where you can go and get internet, high-speed internet at higher speeds than maybe available right now for many families who qualify. And that website, getinternet.gov, will give you information about if you qualify. There's many ways to qualify. It's not just financially, but also if you are part of programs such as free and reduced price lunches at school for your children and things of that nature. So just wanted to make that aware for everybody that that's live now. And it might be something that we share along the way as well, but I just figured I'd share that out.
Great, thank you so much. Appreciate it. Derek?
Yes, good evening, all. Thank you. I don't really have an announcement, but I have a question regarding the $2 million of funding for task force recommendations. Is that one-time money, or is that funds that could be reoccurring every year?
Now that is a one-time set aside that's being proposed in next year's budget.
All right, thank you.
Mm-hmm. Christine?
So just wanted to make sure everybody here understood that we have a small food pantry with dry goods, refrigerated goods, even freezer goods. It's not a super large pantry, but it is available for anyone that needs it. We have office hours to do that. Please call our office to find out more information. Area code 408-894-9041. And just mentioned that you would like to get something from our food pantry. It's open to anyone.
Great, thank you for sharing that resource, Christine. Kira?
I don't know if this is relevant here, but I think I heard it was there. I also saw in the budget presentation that there's $700,000 for civic engagement, and wondering, is that at all related to what we're doing, or is that something unrelated, but something that we would want to know?
Absolutely, you've got a great eye on our budget, Kira. Thank you for adding that as well. So yes, actually in this year's current budget, there has been $500,000 allocated for community engagement as it relates to using the promotores model in our engagement efforts. And city staff, we're actually working on that right now. We have identified about 5 or 6 different community-based organizations that either already have a promotores program where we can just simply pay for those persons to work with us, or they have programs where it's they're looking to develop leadership skills for members of of our communities, and particularly in those zip code areas that have been hardest hit by the pandemic. So that is one piece of the 500,000. In the proposal for 22-23, there is an increase of an additional 500,000. So that would be a total of $1 million for the promotores model. And then the additional $200,000, Kara, is to go toward messaging around vaccination and boosters.
Thank you.
Okay, any other announcements? All right, great. Well, thank you so much for sharing all of that great information with us. So the next item, I think I am kicking this over to Aurelia to introduce our panel discussion this evening.
Great. Thank you so much, Rosalind. Good evening, everyone. Like Rosalind said, my name is Aurelia Bailey, and I am with the office. Oh, no, I'm not with the Office of Emergency Management. I used to be part of the Office of Emergency Management, but they are here tonight, both the city and the county. I'm actually part of the recovery team. I'd like to introduce the County of Santa Clara Office of Emergency Management, Daryl Bray. And with him also tonight is the director, Dana Reed, with in his office. And then also tonight, it says Ray Reardon, who is our director, but it's actually our deputy director, Jay McCamus, who is participating in this presentation. Just to give you a context of how we got here, it's pretty much our steering committee members have requested for the Office of Emergency Management to present tonight on what it means when an emergency operation is activated. So instead of actually doing a big presentation, because we know that this office does a lot of things throughout the city and the county, we're going to do more of a panel of discussion after they give a brief overview from staff. This will then give the task force members, all of you, the opportunity to ask them questions. So I will hand it over to Daryl.
Great, thank you very much, Aurelia. I really appreciate the opportunity to share information about our recovery and answer any questions or have a discussion about our EOC operations to the best extent that I can. I just want to say up front that if there are any public health specific questions, I'll be unable to answer those. I was unable to secure a public health representative. They're super busy with they're calling it a swell. They've switched their S word, used to be a surge, now they're calling it a swell. So just changing terminology there, which is interesting. But they're busy with operations related to that. So I will be able to take back any kind of questions to them if that does come up. We will get you answers. It just might not be immediate and in this venue. So I do apologize ahead of time for that. So I just want to, as we get started here, I just want to point out that, organization is incredibly important, documentation is incredibly important, but above all else, collaboration with stakeholders is absolutely the hands down the most important thing that we can do. So I really appreciate this opportunity to come work with your task force. And I just want to point out that this is just another instance of us collaborating, having a relationship of collaboration between the city and the county. So Aurelia was actually in our EOC during the early stages of the pandemic response, helping to coordinate the food program, food distribution program. That's a great example of collaboration with the city going towards the county there. During the flood event, actually back in 2017, I was assigned to the City of San Jose's EOC, and I helped write the debris plan after that flood. So that's another example of collaboration. And then finally, maybe the best example of collaboration, and we've got Jay McCamus on in the meeting tonight, and he's the deputy director for the City of San Jose. He actually used to be a senior emergency manager with the county a few years ago before he joined your team. So the relationship of collaboration with the City of San Jose is long and it is deep, and I'm just glad to be able to be here to continue that relationship. So thank you very much for inviting me, Aurelia. So this image here just shows our recovery team structure. It is based off of FEMA's recovery framework, National Recovery Framework. It essentially has a management team consisting of a recovery director who is answering or reporting to the CEO and the Board of Supervisors. And that recovery director is managing a resilience committee that is headed by Jackie Nash, who's in public health preparedness currently. And what they're doing is essentially filling any kind of capability gaps that existed before and during the pandemic that were exposed because of the pandemic. They're filling in those gaps by doing after action reports and hot washes and interviews and plan development. We also have a legal counsel to review all of our work and answer any kind of legal questions. We have Maribel Gonzalez with us, or excuse me, Maribel Martinez, who is our AFN coordinator for the recovery team. Myself, I'm the recovery coordinator. And then we have Ricardo, who is our PIO. He's about to actually head up a language access program in the CEO's office. And then we have a liaison group that participates in meetings like this, honestly. So they go to these kinds of functions to make sure that there's a link between the local governments or NGOs and the county. And then finally, we have our recovery support functions. There are 6 recovery support functions. There's the health services recovery support function. What's interesting about the health services recovery support function currently is that they are in the middle of operations at the same time. They're still doing a response and they're doing recovery kind of at the same time. So that one's an interesting one of you know, how do you file this action? Is it a recovery action or is it a response action? So that's always an interesting conversation with them. We also have the housing RSF, who has headed up the Project Home Key for the county here in the last couple of years. We also have Natural and Cultural Resources RSF. That is an inactive RSF there. We still have people designated in case anything comes up, but essentially we have recognized that because this disaster is a bit special, there isn't this recovery framework is really designed for physical damage, recovering physical damage for the most part. So because there isn't physical damage to recover, the natural and cultural resources items are primarily funding streams. And so because it has to do with funding, the finance, the economic recovery support function actually took on those funding streams because there isn't any physical damage to address. We also have the Social Services Agency. They're also, along with the Health Services RSF, they're also in a dance between doing response for the pandemic right now for vulnerable communities in our vulnerable folks and working in recovery. Additionally, I would say in most importantly, probably the most activity comes from the economic recovery support function because most of the recovery, the stuff that you need to conduct a recovery isn't physical, it's financial. And so we, as it relates to the American Rescue Plan or the CARES Act or the HEROES Act, all of those things are financial in nature. And so there's a large amount of activity with our recovery support function, our economic recovery support function. And then finally, we have a county reconstitution RSF. And what that's taken the place of is there, and traditionally there's an infrastructure RSF. And since again, there's no damaged infrastructure, we replaced it with reconstitution. Essentially, many of the departments had to suspend essential services during the pandemic. And this RSF is intended to bring those essential services back online as they're available to do so safely during the pandemic or as we move out of the pandemic. Our overall objectives are pretty broad, but they are to coordinate and facilitate the recovery from the pandemic. That seems pretty straightforward. We develop and disseminate a recovery action plan. So on a month, originally it was on a monthly basis. We put together and everybody got together and said, hey, here are our objectives for the next 30 days. to conduct recovery operations. Here are the actions or activities that we're going to conduct in order to meet those objectives. And we had that conversation and produced a document that memorialized those ideas in what's called a recovery action plan. And we have about 22 of those so far. We have now switched to a 90-day recovery action plan, so we won't produce that for another 2 months. Additionally, we want to work with representatives of the county's access and functional needs communities to understand and address the needs of these communities during the recovery process. I can tell you, having been, I'm a father, so we went through a pregnancy period. My wife obviously went through a pregnancy period. I have been injured myself. I also have sinus issues, and it contributes to some hearing problems. And I think that everybody, or almost everybody, has something like that should be able to connect them to understanding the AFN community and the needs, and how valuable spending time addressing those needs are, because we all benefit from not just the targeted audience, I suppose, that you are intending on providing the benefit to, or the solution to. The whole community benefits when we are looking at access and functional needs issues. So that is huge during the recovery. Oftentimes these folks can get left behind, and we don't want that to happen. Additionally, we want to, again, another big broad one, identify, and this is happening constantly, COVID-19 impacts to the county across these different recovery support functions. We want to ensure strong coordination with the EOC and the County Board of Supervisors. This is interesting. Typically, when you have switched to recovery, at least after as long as we've been doing recovery, there wouldn't be an EOC activated in order to coordinate with. You would be dealing with the departments, and you would be dealing with the Board of Supervisors. But I just wanted to point out that is kind of a specialty of this particular disaster that is different than others, that we still have to coordinate with the EOC in our actions to make sure we're not duplicating efforts, essentially. And then again, we want to provide timely public information regarding county recovery efforts. And I want to point out that there is a recovery website that we've just launched on that, and there is an ability to make comments on the website as well if you want to visit the website and to provide any comments that you might have or feedback on the website. And I'll put that link to the website in the chat after my presentation. All right, that's good for this slide. Okay, so some of the stuff that we learned after during the pandemic. So some of the information sources. So we have done a couple interim AARs, or after action reports, and what that is, just a quick overview of what an after action report is. You get all the players that were involved in the response together. You have what's called an after action meeting, where you look at the objectives that were set during the response, and you all evaluate how well you did meeting those objectives. Maybe you didn't meet them at all. And then you identify the areas of improvement that you can improve to better meet the objectives that you set in the future, if that makes any sense. So it's it's a cycle of improvement. The AAR is the key to that cycle of improvement, being retrospective and looking in on your own programs to see how you can improve to do better next time. So we have a couple of those documents. The public health has one, and OEM has two of them for the EOC that we did as interim documents. We weren't able to go through the full process, but because so much time had elapsed, we didn't want to lose the memory of those things transpiring. And so we put it down on paper, and we are actually about to kick off a formal after action process that will take approximately 8 to 12 months. So I'm thinking about 10 months, starting next month, this month or next month. And so we will, from that, we'll get an improvement plan, and these lessons learned will be formalized in that document. And so I'll go through some of these lessons learned. So Afn Coordinator, that was, we ended up recognizing that was incredibly important. I already expressed our sentiment. My feeling is a shared feeling with the entire county and the Office of Emergency Management as well. So we had to bring back. It's such a personal program that it's not easily. You can't just bring somebody into it who doesn't already have the relationships established with the stakeholder groups. They're not going to be able to accomplish anything. They're going to be starting from scratch. So we had to bring back a legacy person during the operation, because that person had the relationships and they were able to capitalize and leverage those relationships to great effect. Subsequently, the Office of Emergency Management has hired a full-time permanent AFN coordinator. So that person is Marisol Torres, and she is in our office permanently as a permanent staff member, conducting training and outreach on blue sky days. And during an EOC activation, she will fill the AFN coordinator role. Additionally, COOP coordinator, we've recognized that Miguel Marquez is our COO, and there are, with all of the departments providing essential services to the community, it's beyond one person to keep track of all of the status of all the essential functions related to those departments. And so we recognize that we need a designated COOP coordinator. And so we will be designating one and training one over the next year or so. The same goes for a recovery coordinator. Recovery is something that should be thought of as soon as the disaster occurs. So we traditionally, and I would say that this is industry-wide, this isn't county specific, this is industry-wide. Recovery coordinators are usually onboarded when you start recovery or right before you start recovery. We think that it would be we would be better served by onboarding a recovery coordinator early on in the operation. Similar kind of concept with public information. The COVID response, we asked the public to do extraordinary things, and therefore we needed an extraordinary amount of transparency as it relates to our processes and decision making, and that comes from our public information officers or our Joint Information Center. And so getting out with your public messaging early and being involved, not just like a message board, but interacting with the community to really understand what their information needs are, so that way you are not wasting time with ineffective messages. Demobilization. We were overwhelmed with we had thousands of people come through as DSWs for the event, not just in the EOC, but to support vaccine sites and testing sites, etc. And it was overwhelming trying to demobilize them at different times and making sure that we got all of their equipment back. So this is something that we definitely recognized that we needed to button up. So we will be looking at this topic over the next year as well. DSWs, so that's the opposite direction. We brought a bunch of people on, and when they left, it was a bit chaotic to get their stuff back and make sure that everybody was squared away the way that they were, documentation was all there. The same with onboarding them. So there's a great deal of training for some of these roles and responsibilities that you're given in an EOC environment, and we needed to we ended up having to develop just-in-time training on the fly to make sure that these people were spun up with the various systems so that they would be effective. And so that was a big recognition there as well. And then obviously the importance of the disaster recovery framework. We had a draft document before the pandemic. And so we will be using, so this is kind of lessons still being learned currently through the recovery process. As we learn and document those lessons, we will apply it to our final draft of our framework.
Thanks, Daryl. I know that Dolores, you have your hands raised. Can you we have one more slide from Jay McCamus from the City of San Jose. So can you just hold your questions and then we'll go right into that.
That's fine. Thank you.
Thank you.
Mm-hmm.
All right. Good evening, everyone. My name is Jay McCamus. I'm the Deputy Director for the Office of Emergency Management for the City of San Jose. Daryl just did an excellent job of laying out a very broad list of the types of things that we're doing in recovery. And those things are actually worked out in collaboration with the city. I wanted to cover a couple things that he did not cover. One of those is When the Emergency Operations Center is activated, it's done so with a purpose. And that purpose is to coordinate the activities of the emergency organization. And for those who aren't familiar with that term, the emergency organization is simply the jurisdiction under a proclamation of local emergency. So when there is a proclamation of local emergency that is put in place, it allows the city to operate and to focus its resources on whatever the event is. Now, that could be a flooding event or a wildfire, or an earthquake, or in this case, a pandemic. That's what we're recovering from. The Emergency Operations Center is representative of the organization itself. It brings together senior executives and leaders to help coordinate and figure out how they're going to address the problems that arise. And it does so in a very transparent fashion. It shares a lot of information. It is dependent upon the information it gets. So we depend a lot on situational awareness. We get that situational awareness from working with our partners. That means partners in other jurisdictions, partners from the state and federal governments, partners from the nonprofit organizations that we work with and collaborate with, and the public at large. So it's very important. The slide you see here, the 3 concentric circles, as many people know, is a Venn diagram, overlapping circles. Basically, it represents this idea of a whole community. Everybody takes a part in responding to and dealing with emergencies and large-scale events when they happen. It requires the support of volunteers. It requires the support of our partners in the community, of jurisdictions. And again, it's just representative of that. I don't need to really repeat all of the things that Daryl said, but I will say that all of these things that we do are covered in the state's emergency management system, what they call the standardized emergency management system, that kind of governs all of our emergency management work and our response work. And so there's not a lot of guesswork involved with it. It allows us to maintain the same structures, use the similar language, communicate our needs in the same way. And it helps us in that collaboration that Daryl brought up. And I think I'll leave it there and open it up for questions.
Thanks, Jay. We'll go right into Dolores. Dolores, I know you have a question for both Daryl and Jay.
Well, yeah, thank you, Aurelia. And thank you to both gentlemen for being here with us tonight. I think this is super important. So 2 questions. One is more retro. When the EOC is activated, because you're now in recovery mode, I'm assuming, based on my experience anyway, and things could have changed, that the structure, the hierarchical structure changes. Because am I correct in that the public health, the medical, given the situation we had with COVID, it was the PhD director, medical director, who oversaw the whole thing, or am I incorrect? How did that look, the structure, while you were activated?
Sure. So,
I'm going to have another question after that, so don't. Okay, thanks.
Yeah, great.
Thank you. Mhm.
A wealth of curiosity. Excellent. All right. So, Dr. Cody.
Yes.
Has kind of 2 roles: public health officer, and then the director of public health. And so, as the public health officer, she can issue orders. That the public health officer can issue public health orders, which are legally enforceable. And that's all I'll say about that, because I would want public health to represent that aspect any deeper than that. But there's also the public health department that is doing the operations, right? So there are the legal orders, and then there's the operation that's taking place that may be implementing some of the order as well, right? And so Dr. Cody works in the EOC as the public health officer with county council and the CEO in order to make sure that those policy decisions are all that they're all checked and balanced, if you know what, that all of the implications and consequences of making that public health order are understood by all of the county leadership, essentially. So that's with the public health officer. But additionally, as the public health director, the leader of a bureaucratic department, she is the Department Operations Center director for the public health department. She isn't the only one, but she is one of the directors for the what we call a DOC, a Department Operations Center. And there she is overseeing all of the planning and implementation of the plans or the operations of the response itself. So the vaccine sites and the testing sites and the pop-up mobile unit, all of those operations are planned and executed by public health employees that she supervises.
Is the structure with the board of supervisors at the top the same during activation and recovery?
Yes, this board of supervisors, the administration, the county administration, the executive staff answers always to the board of supervisors. It's just a matter of when. Honestly, it's just a matter of when. So am I answering to them tomorrow or am I answering to them today? They are always answering to the board of supervisors.
Thank you.
You bet.
And I was interested in the comments you made about the recovery, the after action report. Dr. Smith has referred to it in many meetings now. And how are the community health clinics going to be involved in that? Given that this last emergency was was medical, clinical, really. I would think, and by the way, I should tell you, I represent the community clinics, so that's why I'm asking. Do you happen to know at this point?
Great. So I would say that when they develop the project management plan, they will have to identify all of the stakeholder groups, and this is in our contract that we are currently in negotiation with them that they will have to, depending on the level of participation and authority level, you'll either be interviewed, a one-on-one interview or maybe over the phone kind of thing, or you'll get a survey that you'll have to fill out. And that includes we plan on having 2 town halls through that process. We plan on doing a community survey that'll go out to the public via Facebook and a couple other sources, and we'll compile all that stuff together. Honestly, it's a matter of having conversations like this and identifying the groups that need to go on the list.
Good. And would you mind putting up your slide one more time, or is it too cumbersome to do that? Where would that communication come from? So we can look for it. The one before that. There was the recovery support functions, and would it come from Amy Carta or would it come from Maribel?
That's a great question. We haven't figured, and this is what you're talking about is the development of the project management plan. But it could come from me as the recovery coordinator, or we could leverage these RSFs who already have the relationships. So we'll end up having to discuss this as a team. But I tell you what, Dolores, I mean, I've got eyes on you. I'm going to make sure you get an invitation.
Well, I hope, thank you. We definitely want to participate. Thank you.
And and we're also recording and we're taking notes, and so we'll make sure that we hand off a lot of this stuff back to Daryl and Jay. I know I need to do a time check because we do have one more item that is on our agenda for tonight. So Christine, I know you have your hands raised.
Yes, thank you. Understanding that this was a health emergency process, a large scale one at that, no less. And considering that when this all started, we were also experiencing wildfires and several other incidents around our area and around the region. And there was some snags along the way. what is being done to better develop interdisciplinary quick action processes to address these things. Let me give you an example of what I'm referring to. During the pandemic, and let's face it, guys, we're not out of the pandemic. But when we were in, I'll use the current term, a large swell, which I find interesting. We had people going from one place to another, kind of a mixed bag of where should a person with COVID go versus where are they going. This caused a lot of anxiousness, frustration, any number of other things. And luckily we were able to move forward from that. But looking into the future, and please God, nothing more than this, you know, how better to address that as things, let's face it, fall apart as they did.
Okay. So I would say, I'm assuming that's a question for me. I don't know.
Yes.
Okay. So I would say a couple things. So number one, this resilience committee, that's their reason for existence, is to develop, to increase our resilience as it relates to pandemics, to exactly what you just described there at the end. And so they're doing that through an after action process that will follow the exact same one that we will do later. But what they are focused on is public health specifically in this box here, whereas we will do the EOC response, the county's broader response outside of public health. That's what our after action report will consist of. So that is the process for what you're talking about, Christine, is hosting an after action meeting where you identify all of the areas of improvement, is what we call them, areas of improvement. And then you do from there, you say, well, what is a recommended course of action or remediation action for this area of improvement? And then you assign a point of contact that is now responsible for that remedial action. And that essentially becomes your work plan. And that's really how emergency management is conducted. Like I said before, we're a constant improvement cycle where an event happens or we have an exercise, one of the two, and we do a self-examination of where we can improve, and then we build a work plan to do those improvements. And that happens every year, regardless of this pandemic. And so therefore, the pandemic has, snapped that trap closed, and now public health is going and doing that, because that's what we would do, or is look at ourselves, develop an improvement plan, implement that improvement plan.
So thank you. We have one more question, and Tira, I believe you're up next.
Okay, try to make this quick. So I noticed in your after action report that there is this community engagement process or plan, and that's great. In the formulation of the kind of, back to that other side of the slide that you just had to have the what? Okay, in this slide where it says there's going to be development and dissemination of a recovery action plan, and there's all these different like support functions, is there a community engagement piece to this as well? And if not, can we have one?
Sure. So that is what this liaison group is for doing community engagement. So I suppose it's now a matter of connecting is what it is making sure that you're connected with our liaison group. And then that person will attend stuff that you would like them to attend. And then you can also, they can let you know about stuff that you could attend for us. That's their role.
And in this scenario, it would be Hillary.
We will use Hillary. I think she actually passed the job on, but okay. We will use it. She'll push us to the right direction. Yeah.
Perfect. Thank you. Kara, did that answer your question?
That's the answer, but I don't think that's, that's not what I'm kind of looking for. I think when you look at across all those recovery support functions and the very big differences between, how you're going to respond to like the small business needs that Margaret does versus how, social services might be delivered differently.
I do want to point out, and I should have said this, absolutely. These individual RSFs, particularly, and like I said, there's so much activity around the economic RSF because of all of the grant funding that's come through. These groups do meet with community groups, particularly the economic RSF. They do a great deal of webinars. That's how they get the money out the door, honestly. Otherwise, it would just sit there and nobody would know about it. So they have to host those webinars in order to advertise the fact that the grant dollars are available.
Thanks for the information.
Yes, ma'am.
Thank you. And then part of the notes that we're going to send out to the task force is we'll make sure that we add both Jay and Daryl's information so that for any other questions the task force may have, please feel free to go ahead and reach out to them. I just wanted to say thank you so much again to Daryl and to Jay. Appreciate your collaboration as always. So thank you for taking the time tonight. And then with that, I'm going to go ahead and pass it on to Carlos.
Hello, everyone. So I just wanted to get into the next section of the final section of our agenda for tonight, which is the community engagement plan update and lived experience group update. And for that, I want to introduce Araceli Gonzalez, who is the chair of our community engagement committee, who's going to walk us through this section of the agenda. Hello, Araceli.
Hello, Carlos. Hello, everybody. Thank you again, Daryl and Jay, for sharing all the great information. And thank you, Aurelia. So yesterday, a copy of the final draft went out to the community. The draft for the community engagement plan was distributed to all the task force members. Hopefully you all had time to review it. The plan was also reviewed in our meeting last week that we had for our community engagement. And our recommendation was that we bring it today and we have it approved by the task force tonight. So hopefully you all had the opportunity to review the plan. Here again is the community engagement strategies of the plan. What we shared last month in our task force meeting. This is how we will connect the community to gather the input needed to support the task force recommendations. Next slide, please. Thank you to all the committees and the task force members who have provided input in the framework, in the approach for the survivors, and shared with us the input we wanted to receive for the community recommendations. We, along with the city and the consultants, will be working with this month. We will be working this month to develop the survey, a toolkit for the task force members, with tips to share the survey and to host their own activities and events, and build our calendar of engagement activities for the summer. We will be sharing these for your approval at the next task force meeting on June 9th. These events and engagements will go from June to August. And in September, you will be receiving an analysis and review of what we've heard from residents in City of San Jose to inform and finalize your recommendations. Again, the community engagement committee recommendation tonight is for the task force to approve the plan tonight.
Thank you, Araceli. So I think unless there's any questions about the community engagement plan, we would entertain a motion to approve the plan.
And Aurelia, maybe if you could go back to the previous slide so all of the task force members can see the 5 major components of the plan. Okay.
Thank you, Rosalyn.
Mm-hmm.
I'll
there
move
any-
to, I'll move to approve and thank Araceli for her work as the chair and the whole team that's on that committee.
I'd like to second that motion. This is Mary Ann Dewan.
All right, so I think we can go into the voting portion of the meeting. So, so all folks who vote to approve the plan, if you can go ahead and use the reaction button with your thumbs up, and we can use that. So this is only for task force members, primary members to raise your thumb if you approve the plan as well. And keep them up for a little bit so we can count. And just keep them up, just so we can. I guess we just have to do our count.
Carlos, if we could use the raise hand feature.
Yeah. I'm sorry. Raise hand. I apologize. So I see 21 folks here with the raised hand. Okay, let's go ahead and put those down. So all right, so if we can have folks who do not approve the plan to raise your hand. Okay, I think we have no hands. And then if there's anybody, so if we can have one more final vote for folks who choose to abstain from voting today. Looks like we have one abstention. All right, so I think we have a vote here with an approval of the plan. Thank you so much, everyone.
Thank you, everybody. If we could go to 2 slides down. One more. Okay, thank you. We also have an update for the lived experience group, which is a key strategy of the community engagement plan. As we mentioned last month, the lived experience group is a group of 10 community residents and stakeholders with lived experience relevant to the impact of COVID-19. Each member will plan and carry out 3 community activities or events throughout the summer. These events can be focus groups with neighborhoods, community workshops, and many more. Using the information provided by our group, the Community Engagement Committee, the Steering Committee, and the task force members on the criteria for the lived experience group members and the organizations who recommended the candidates. City staff and our consultants worked to identify candidates for this lived experience group. As you can see here, 37 organizations were contacted through phone calls and informational emails. The city staff and our consultants connected with 22 of the organizations, 14 of those which met via phone or via Zoom. From these organizations that were connected, 26 people submitted their interest in the lived experience group. Using an online application from what we kept simple and translated into Spanish and Vietnamese. City staff and the consultants met with 17 of the applications who met the criteria for a 30-minute conversation, just to learn a little bit more, then answer some questions that they had. Next slide, please. Here is the list of the approved lived experience group members. Welcome. It was important for us to meet as much as the criteria on the lived experience group and were as recommended by the task force. The members of the lived experience group met more than one of the criteria. It was also important for the groups reflect as much as possible the diversity of San Jose in the lived experience group. LGBTQ, African American, Afro-Latino, Latino and immigrant community, Asian American, Vietnamese, and formerly unhoused community are all represented here. It is also important to mention that the lived experience criteria we shared is not a comprehensive of the experience of the group. It is only what they chose to share with us. We are also happy to say that we have some of the members here in the lived experience group with us tonight. And we'd like to give them some space to say hello and make a comment if they wish. Carlos, would you invite these to speak?
Yeah, of course. So I know that we have some of the members of the lived experience group here. We don't have time for questions, but if there are any of the members here who would like to say hello or make a quick comment about being on the group, if they can use the raise their hand feature and we can call on them. Don't want to. I see Ellen. Maybe go ahead, Ellen. I know that you're here, so thank you for joining us. Go ahead.
Okay, thank you. Thank you for having me here. I'm excited to participate. Oh, did I lose you?
No, right here.
Okay, all right. I'm excited to participate and look forward to seeing how this assists in our recovery from COVID.
Welcome, Ellen.
Thank you.
Thank you, Ellen. And I know that we have some of the other members of the lived experience group but thank you so much for joining us tonight. So I think that is the conclusion of our presentation. Is that right, Felicity?
Yes. Thank you, everybody, for your time.
Great. So unless there are any questions for us, we will transition into the next section of the agenda. One other item I just wanted to make sure we mentioned is that Araceli did mention that this lived experience group was approved by was adopted by the steering committee at last week's meeting. So so thank you again. All right. So I think with that, unless there are other questions, we'll go into the public comment portion of the period of the presentation. So if there are members of the community here who would like to make a public comment, we ask that you raise your hand right now and we can call on you. Okay. Don't know if I see any raised hands here.
Okay.
I think we're good. Oh,
one hand just went up. Lon?
Hi, very impressed with the progress. Congrats, everyone. My quick comment is that it will be great to join the small business subcommittee so that some energy could be utilized in that group. So thank you.
Thank you so much, and thank you for your interest in the Small Business Committee. Are there any other members of the public who would like to speak? Because I know we're a bit over time. I don't see any other hands. So the next slide is just a reminder of our next task force meeting, which is on Thursday, June 9th at 6 p.m. We do have committee meetings that are going to be meeting immediately after this call. So feel free, those Zoom links were sent out to everyone, should you be interested in participate in those committee meetings. And with that, thank you so much for participating. Thank you so much, Araceli, for your presentation and update on the community engagement plan. We're super excited about working with the lived experience group and all that I know that they will be able to contribute to our efforts. So thank you all so much. Carlos, Aurelia, have I forgotten anything? Rob, have I forgotten anything?
Oh, I think we're good.
All right.
All right, everyone, have a good night.
Thank you all.
Thank you all.
Bye-bye, everyone.